Hi, I'm Trevor Schufelt from the Dauphin Clinic Pharmacy. Today I'm going to talk about the very common blood thinner called Warfarin and the test we use to see how thin your blood is when you're on Warfarin called INR. Back in pharmacy school, they made us do a public speaking course, and I did fairly well. And it was in a big fancy hall in the university, big dining hall, and I was doing really well in my speech until I got to the part about trying to say fork and spoon. I couldn't say it. No matter how many times I tried, all I kept saying was spork and foon, spork and foon. That's what I like about these pre-recorded talks, is I can keep going till I might not sound perfect, but much better than spork and foon. INR is the acronym for the International Normalized Ratio, and that is just a ratio to say how thin the blood is, and it's been standardized so it's going to be the same number from lab to lab, from hospital to hospital across the world. Generally, the higher the INR, the more thin your blood is, and the lower, the more likely it clots. Having your blood clot is very important. If your blood didn't clot, every time you got a cut of any kind, you would bleed to death. So blood clotting is essential for life. That way every small scratch or bruise doesn't lead to death. Blood clotting is a very complicated process involving lots of different factors and chemicals. But generally, there's sort of two main parts of it that might work independently or together. There's platelets and there's fibrin. When we're talking about warfarin, we're talking about the sort of fibrin half of the blood clot and how the warfarin affects that. And warfarin in particular affects the part of the fibrin that involves vitamin K. We'll get to more to that later. Warfarin makes your blood clot more slowly, or makes your INR higher. That's why we call it a blood thinner. Your doctor is going to prescribe warfarin for you if they think you're at risk of getting a clot where we don't want a clot to happen. Blood clots in different areas of the body can cause different problems. For example, a blood clot in the brain can kill off a section of the brain, and we call that a stroke. A blood clot in the heart kill off a section of the heart muscle, we call that a heart attack. Blood clot in the leg kills off can block off blood returning to the heart, we call that a DVT. So DVT in the leg, heart attack, obviously if it happens in the heart, and a stroke if it happens in the brain. Having certain conditions can put you at risk for having a heart attack. For example, if you have an artificial heart valve, that increases your chance of forming a clot, and that could lead to a stroke. There are genetic conditions that make you more likely to have a stroke. And there's a type of irregular heartbeat called AFib, or atrial fibrillation. Again, makes it more likely for a clot to form in your heart, fly up into your brain, and that would be a stroke. Also, people who have had past strokes, past heart attacks, and past DVTs, remember we talked about those before, those are the blood clots in the leg, they're more likely to have a clot in the future. Warfarin is a finicky drug. If you're on a blood pressure pill, it's entirely possible that you're going to be on the same dose of that blood pressure pill for years and years. Warfarin isn't usually like that. Most people on warfarin will probably have to have their INR checked on a regular basis, weekly, monthly, quarterly, to see how thin their blood is. Usually the doctors are aiming for a INR number between 2 and 3 for how thin their blood is. If your INR goes below 2, you're at risk of having extra clots. That's bad. But if your INR goes above 3, you're at risk of bleeding in places we don't want you to be. And warfarin is such a finicky drug because so many things a patient does can affect their INR and thus their warfarin dose. The most common reason for someone to have their INR bounce all over the place is they're not remembering to take their pills. I know this sounds like a no-brainer, but if you're a busy person, remembering to take your pills at the same time every day can be a tough thing. So talk to your pharmacist. They could put your medications in bubble packs or other compliance aids, which help you remember to take your medication every day. Nice is almost everybody has a smartphone in their pocket now, and smartphone calendars will beep at you whenever you tell them to, but probably the best thing is just try to work it into your routine. So if you're always taking your medication, like your warfarin, before breakfast because you find that easy to remember, just work it into the routine so you do it at the same time that you do something else every day. Vitamin K is crucial for the blood clotting cascade. It doesn't happen without it. And warfarin is a vitamin K antagonist. So warfarin directly inhibits the effects of vitamin K in the clotting cascade. So that's what warfarin does. In fact, vitamin K, we even use it as a warfarin antidote. If someone gets too much warfarin, the vitamin K will stop warfarin from working. And yeah, so if we give them, and they're bleeding on that too much, we'll give them vitamin K to stop the effects of warfarin. So vitamin K brings us to the second most common reason we have problems with people on warfarin is their diet. So this is kale. Kale has lots of vitamin K in it. So it has spinach, collard greens, turnip greens, Brussels sprouts. Now these are fantastic vegetables and we want people to eat them. They've got lots of vitamins, minerals, fiber in them, but we just want people on warfarin to eat about the same amount of these vegetables every day. We don't want someone on warfarin to suddenly go on an all kale diet. Alcohol can affect how someone's blood clots as well, so ideally someone on warfarin will only have 1 to 2 alcoholic drinks per day. Let's talk about the red flags. If somebody's on warfarin, here's when they should either see their doctor right away or even go see the emergency room. If you're on warfarin and you vomit and it looks like coffee grounds, if you have very severe nosebleeds, if your urines turn brown or red, if your stools or poops are black and tarry, or if you have a very painful swollen injury, by that means you roll an ankle and it immediately turns red and very painful and swollen, see your doctor as soon as you can, or failing that, actually go to the emergency room because these could be signs of uncontrolled bleeding. So warfarin is a good and safe drug, and it'll help us prevent things like heart attacks, strokes, and DVTs. INR is the test we use to see how thin your blood is, and usually we're aiming for a range between 2 and 3. If your INR goes outside of the range between 2 and 3, your doctor will adjust your warfarin dose and get you back on track. Now, let's everybody go out and have a spork and foon-free day.